As a doctor, I usually ask my patient, hey, what symptoms do you have? And then they will tell, hey doc, I have cough. And he will oftentimes say that, hey doc, I have dry cough for just 2 days. So if that is a case, the cough doesn't require antibiotics. Why? Because that cough is usually viral in origin. If there is a case of doc, I have a colored phlegm, yellowish, greenish phlegm, that is one of the cases wherein antibiotics is required. Okay, because it has been from a viral phlegm to a bacterial kind.
Hi everybody, welcome again to another episode of Simply Healed by Simply Nature. Today we have again our special guest, Dr. Meddie, all right? Dr. Imelda Meddie. And she's the chief doctor, the head doctor of HICC. And we interviewed her the last time. Such a touching and wonderful interview about integrative medicine and how she got into it. Well, today we're very honored to have her. Like I said, she is young and dynamic, a very experienced doctor, constantly travels the globe to attend medical conferences, always sharing new techniques and on the cutting edge. Today, we're going to talk about the topic of lungs, right? So it's COVID-19, so lungs is important. So stay tuned, all right? So let's put our hands together and just welcome Dr. Meddie. Hi, Doctor.
Hi. Good morning, good afternoon to everyone who's listening. Magandang araw po sa ating lahat. And thank you for watching Simply Nature.
How do you feel about where Philippines is right now when it comes to the COVID situation?
Hopefully, Philippines is doing good, but unfortunately, by statistics, we are top one in Southeast Asia.
Yeah.
The most population with the highest rate of COVID-19. So I don't know if I'm going to rejoice or if I'm going to top one. It seldom happens. Yeah, this is a rare opportunity for the Philippines.
But I mean, that's why today's topic is so important. We're going to talk about lungs, right? And yes. For COVID-19, the infection actually starts in the lungs. Am I correct?
Yes, correct. Everything, the COVID-19 starts from our respiratory system.
Wow. Okay. So today, Doc Meddie is going to share with us why is your lungs important. Then we're going into details about the common respiratory ailments. And we will go into a bit of detail into things that are more serious like emphysema, TB, maybe even pneumonia. And most important, why you need to stick all the way through the webinar is towards the end, Dr. Meddie will share with us how can we address lung diseases naturally, right? Of course, you would take your antibiotics for TB and so on and so forth. But how do you take care of your lungs and how do you treat lung ailments naturally? So Doc, without further ado, can you share with us the role of the lung? Why is it important and how does it work? And yeah.
Yes, our lungs is very important because it is part of our respiratory system. The respiratory system is the exchange of gases, exchange of oxygen and exchange of carbon dioxide in the form of respiration or breathing. It is the one process that our body is really vital with, because when we only last for around 2 to 3 minutes, maximum of 5 minutes, if we do not exhale and inhale, if we do not respirate. Yes. So it's one of the processes that is very vital, and it's actually life or death.
Wow. Actually, we always when we talk about healthy living, we always talk about drinking lots of water, vitamin C, multivitamins, minerals. But we seldom think about taking care of our lungs because of the traffic, the pollution and everything. What's the state of the lungs in Philippines from your experience with patients?
Personally, I have seen two kinds of patients. The one that live in the metro or the urban, they live in Metro Manila. Yes, Metro Manila, area is really polluted. You know, there are lots of fog. There
Wow.
are lots of pollution in Metro Manila. Meanwhile, I have also worked with Filipinos who live in the rural areas, in the provinces.
All right.
What I can see is patients from the province, patients whose air is so clean, are less prone to lung diseases versus Filipinos who are in the metro that
Mm,
lives in a not so clean air. They
mm,
live areas where there is high pollution, and when you're in traffic, you are traveling a lot. There is in traffic. There are lots of population areas where there is smoke.
mm.
We have seen an increase in rates for lung diseases.
Wow. Doc, I mean, the most two common lung ailments that we associate with is probably the flu and the cold, right? Yeah.
Yeah,
So
flu and the
I
flu.
always thought it's the same thing, but is the cold and the flu two different things?
Yes, they're completely different. Though
Oh, wow.
some of the symptoms, yeah,
I always thought having a flu and cold is the same thing. It's not?
it's not. It's not.
Okay,
It's
what's
not.
the difference?
Yeah. Okay, the difference between colds and flu is colds usually is just on the upper respiratory area. It's
Okay.
just on the nose, yes. It does not involve a systemic infection. A flu
Oh,
or influenza, meanwhile, is a state of or condition of the body wherein a specific virus has entered our body systemically. It's general. So
mm.
the symptoms are all general. When you have colds, you only have rhinitis or you have
Oh, blowing nose, right? Running nose.
yes, runny nose. You have runny nose. You have you may sometimes have sipon. Yeah, sipon is cold.
Okay.
But you will not have fever.
No fever. Oh,
No
cold has no
fever.
fever. All
Yes,
right.
yes. No fever, no body weakness. It's just a runny nose.
Oh, wow. Okay. So now I know.
Yes, yes.
So the COVID-19 is a type of flu, is it?
Basically, yes, it is a type of flu. Sometimes flu is, most often, flu is caused by viruses.
Con, con, by viruses. All right.
By viruses, yes, yes. One of the types of virus that can cause flu is actually coronavirus. It is not the first time that
Oh,
a person has been infected with the coronavirus.
yes.
Okay,
I read.
yes,
Yes, I read recently that some people actually recognize their bodies recognize COVID-19, and that's why they don't actually get sick.
yes, yes. It's not the first time that coronavirus has infected us in the
Mm,
form of flu. But
mm,
the real interesting here with this specific COVID-19,
mm.
it's the spreadability. It is
Oh,
actually this specific coronavirus has mutated,
mm.
and the spreadability of the virus is really fast.
And the
So this is,
mortality rate is much higher than the normal flu, right? Uh,
yes,
yes.
yes, especially for those patients whose conditions are complicated, meaning they have conditions prior to having the flu.
Wow. Okay, apart from COVID-19, cold and flu, what are the other common lung issues in the Philippines that you have encountered?
Okay, one of the common lung infections too that is quite rampant in the Philippines. They say that if you have just cough
Hmm.
and we diagnose it as pulmonary tuberculosis,
Oh,
a
pulmonary tuberculosis.
yes,
Hmm.
a Filipino doctor is right 70% of the time.
Wow. So if a person in Philippines coughs, 70% of the time they actually have some form of mild case or serious case of tuberculosis.
Yes,
Pulmonary
that is true. That is
Wow.
that is what our professor told us whenever I'm in med school.
Wow.
So that if that specific patient has a cough for at least 2 weeks,
Uh-huh.
and if you diagnose that a person with tuberculosis,
Huh?
you are right 70% of the time. Why? Because tuberculosis is really rampant in the Philippines.
Wow. Okay. So the next time anybody coughs near me, I'm gonna run away. Oh, so I also heard that most people actually carry tuberculosis bacteria. It's a bacteria, right, for tuberculosis?
Yes.
Or is it?
Yes.
Did they actually carry it in their lungs for most people?
Yes, tuberculosis can be pulmonary, meaning they live in the lungs. And
Okay.
the part of the lungs that they are most interested to live in is
Yes.
the upper area of the lungs.
Oh, wow. Okay.
Yes, yes, because the upper area of the lungs is the most oxygen-rich area of the lungs.
Oh, because we don't breathe deeply, right? So the oxygen stays there. Oh,
Yes,
okay.
yes, the upper part. So it's an interesting fact.
How
Really great.
dangerous is TB? Do many people have TB but not realize it, and then they sort of get well? Or is TB something very dangerous?
Okay, we have what we call tuberculosis in children.
Mm.
And then when we diagnose tuberculosis in children is a commonly not, children cannot transmit tuberculosis. Adults.
Okay. All right.
But adults can easily transmit tuberculosis to children.
Oh, okay.
Okay. So when a specific child has tuberculosis, the most common symptom is cough, long-term cough for at least 2 weeks.
Oh,
And
so if your
also-
child coughs for more than 2 weeks, you should be concerned. Yes.
Yes, and also that specific child has fever at night.
Fever at night. All right. Okay.
Yes. And then other associated symptoms like weight loss, decrease in appetite, there comes it. And then when the patient has that, they usually subject the child to a long-term anti-tuberculosis treatments for at least 6 months.
Wow. If tuberculosis doesn't get treated, what happens? I mean, how bad can it get?
Very good question. We have a level up diagnosis for tuberculosis. If the specific patient was diagnosed with TB, and the therapy should last at least 6 months, because there are therapies that would last for around 1 year.
Wow.
But Filipinos, they tend to get impatient.
Okay.
Yes, such a long time, 6 months, and then they stop the treatment at 2 months.
Okay, Doc, before you continue, why is the treatment so long? What actually is happening in the treatment that it will take 1 year, 6 months?
Yes, very good question. Tuberculosis is a hard disease to combat with during the 1900s.
Okay.
So it took a while for our doctors to formulate some specific drugs or synthetic medications to combat tuberculosis. And combating tuberculosis will not require just one drug. It usually requires minimum of 2 to up to 4 drugs to combat tuberculosis.
Okay.
It's really hard to treat. And the interesting fact about tuberculosis is it's most commonly found on the lungs, but it does not live just on the lungs.
Okay.
It goes to the bones.
Bones?
Yeah, there is a thing like a tuberculosis of the bones. There is such a thing as tuberculosis of the neck, tuberculosis of the lymph nodes, even tuberculosis of the heart.
Wow, I did not know that. Learning something new today. Yeah.
Yeah, there are many kinds of tuberculosis. So it's hard to treat, and then it needs a long time for it to be treated good. Okay. So if the specific patient is impatient, with the 6 months period, then we get what we call a multiple drug resistant tuberculosis.
Okay. Yeah. Wow.
Yeah, because that patient who has TB and was treated with tuberculosis and not get well, the TB mutates.
And it becomes resistant to the drug.
Yes, that is what happens. It becomes harder to treat the second time around.
Wow. I actually had an experience with that. One of my partners had tuberculosis in Singapore, and all of us had to go for a test. And even though we were negative, the doctor did say that because we were in such close proximity and we share food, she suggested we went on a cocktail of antibiotics. Right. And I did ask her, because she said that to be sure, you use the really effective one because you don't really want to train the TB up with weak antibiotics and don't kill it.
True.
Yeah, then I did ask her, is there any side effects to the tuberculosis antibiotics? And she actually told me there was like a 30%, which is pretty high, chance of damaging the liver. Not destroying, but you will do some damage to the liver, which the liver can recover, but that was still something that scared me. Doc Meddie, is there a way that we can like treat tuberculosis or at least help the recovery from TB or to protect yourself from TB naturally?
Yes, of course. Yes,
Oh,
of
wow.
course. There are cases that tuberculosis has been treated naturally with strict vegan diet with lots of juicing, and it's called Gerson therapy. When the body is in an infected environment, or if the body has an infection,
Okay.
what natural doctors do is increasing the immunity naturally.
Okay. Increase the
Yes.
immune.
Increasing the immune system naturally, because we believe, the natural doctors believe that if you just give the body a great natural condition where it can heal, it can heal naturally.
Okay. So that means the strategy with the Gerson therapy or any protocol for a natural doctor is to increase the immune system activity, lower inflammation, I assume. So
Yes.
That means taking lots of antioxidants, which helps to manage inflammation. Is that the main two strategies? Increase immune system and lower inflammation?
Yes, of course. Increasing immunity almost always equates to decrease in inflammation, because the inflammation is the body's activity to heal itself, actually.
Okay.
So most during the early states of recovery, the body must be inflamed.
Oh, so
Yes,
inflammation is a natural positive reaction.
yes, the inflammation is a natural positive reaction. It's actually a natural phenomenon.
Oh,
So
why do we hear this thing called cytokine storm? Because of COVID-19, we hear that when your lungs and body gets this cytokine storm, and that's when you end up in the ICU. So what's that about?
Yes. Cytokine storm is a state of the immune system wherein it bombards the body with lots of antibodies.
Okay. Isn't that good? Isn't that good?
It's actually good, but the thing is, if the body is subjected to a lot of conditions before that coronavirus, before that specific cytokine storm, the body is unable to recover fast. Because when we do high amounts of antibodies, it has to really be sequestered again and being pulled out of the body. But the thing is, if the patient has diabetes, if the patient is currently inflamed, he has hypertension, he has arthritis all over, he has psoriasis, so the body is in a state of inflammation. And then coronavirus comes
and create more
higher level. Yes, that will yield another higher version of inflammation. The body cannot actually recover as fast. And that is where complications arise.
Oh, okay. So that's the reason why healthy, normal people who don't have inflammation, when they get COVID-19, they are not at risk, because the inflammation that comes from fighting COVID-19 can be easily managed and repaired. But if you are diabetic, you are already inflamed, then here comes the COVID-19 inflammation, and that just pushes your body off the cliff, right?
Yes, correct. It pushes the body, hey, I cannot handle this anymore. I am too well inflamed. I cannot handle this. I am gravely affected with all other conditions, and then this another virus comes in, the body cannot handle it. So you need to go into respiratory failure, lung failure, renal failure, and then heart failure, and so on.
Doc, I think just talking to you, lungs are really important, because we both deal with so many cancer patients, and I've heard so many times a cancer patient is doing well, maybe whether they're on chemo or not chemo, but let's say they're doing well, and then suddenly they caught a flu, and then they actually die of pneumonia. They die of pneumonia. So from what you're sharing with me, it's like the lungs is a very sensitive organ, and it's one where I guess it's always exposed to external virus because we're always breathing in. And then if you have a condition like cancer, so your inflammation is very high because your body's fighting cancer, then your lungs get infected, and then that's it.
That is entirely true. Do you know what? I haven't even realized this. Within 1 minute, we use our respiratory system, the respiratory cycle. The breathing rate is 16 to 20 times. So imagine how many minutes we've been talking, and then how many times that the oxygen and the carbon dioxide exchange has been happening inside of us.
Wow, and also how many germs and bacteria we breathe in.
Yeah. Imagine we're talking in EDSA, highly polluted areas. So imagine how many pathogens, how many how many not so good things that we are inhaling every time.
Wow. So when we talk about lungs, we can also talk about heavy metal contamination, right? Do we breathe in the lead? Does it actually go through our lungs and get into our system?
Yes, it goes to our lungs, and it's being absorbed all over our body.
Wow. Okay, Doc, let's go to another lung disease, but I will remember to ask you, for all of us, especially those who are Manilans living here in Metro Manila, how do we clean our lungs? But don't answer now. Let's keep us in suspense. But let's move on to I won't forget this one. How do we clean our lungs? Okay, let's move on to emphysema. What's emphysema? It's another common but serious lung ailment, right?
Yes, emphysema is usually a condition of the lungs wherein the patient is a long-time smoker.
Okay.
The emphysema is the inability of the lungs to aerate as much.
Oh,
so the lungs, So the lungs, because of the so many toxicity in the lungs, from a light brown, it has become around black.
Wow. Okay, that's definitely smoker and polluted air kind of lung. Yeah.
Yes. So the lungs, with all of the bad things inside, it cannot expand as much as it needs to be.
That's emphysema.
Can that be
cured? Can that be cured?
It can be controlled, yes, because there are many attacks. There are many asthma-like attacks when you have emphysema. And then the patient can fully inhale and fully exhale.
And even if they inhale, it's actually very little air, so they don't feel nourished, right? They don't feel...
Yes, because they cannot fully exhale. So the lungs is on a state of inhalation. It's always inhaling. So when you deep inhale, it can only expand as much, but it cannot exhale.
Is there a cure for emphysema? Can we successfully treat that and reverse that completely?
If the emphysema condition is caught on the early term, it can actually be controlled and reversed.
Wow, okay, so that's good news. So it's important to catch it early. We talked about emphysema, pneumonia, we talked about TB. So Doc, for a normal person, what symptoms should we be worried? Because I like for example, TB. Many people who have tuberculosis have no idea they have tuberculosis, right? Yeah. So is there any general diagnosis or physical symptoms that if we notice it, we should go and check or consider to do something about our lungs? Okay.
The most common symptom that we have for tuberculosis, for pneumonia, is at least the cough.
Cough.
Okay, cough. I remember cough, and it's been there for at least 2 weeks.
But Doc, there are many types of cough. There is the dry cough, the wet cough. Because I'm Chinese, right? So we grew up with traditional Chinese medicine. So there is such thing as the dry cough and the wet cough.
Oh yeah.
In a conventional medicine, do doctors also differentiate the different types of cough? You know, the cough that is has an echoey sound. There's the dry cough, right? And then there's the cough which has the phlegm, you know, which that's the wet cough. So what are all these different coughs, and which one should we be concerned about?
Okay, as a doctor, I usually ask my patient, hey, what symptoms do you have? And then they will tell, hey doc, I have cough. So my next question is, what kind of cough? Is it dry or do you have a phlegm? And then the patient will tell, hey doc, I have dry cough. And then I will ask him, how many days, how long have you been having that dry cough? And he will oftentimes say that, hey doc, I have dry cough for just 2 days. So if that is the case, the cough doesn't require antibiotics. Why? Because that cough is usually viral in origin.
Ah, okay.
Yes. The patient most commonly has acute bronchitis because of virus. Yes. So it doesn't require antibiotics. It just requires natural things: rest, good doses of vitamin C, a great diet, and of course PPARs.
Yeah.
And another kind of cough is called the cough that has phlegm.
Who has a phlegm? Yeah.
And then I will ask the patient, what kind of phlegm do you have?
Oh, the color.
What color of the phlegm do you have? Do you have a white phlegm or the colored phlegm? Okay. And if the patient will tell me, hey doc, I have a white kind of phlegm, I will then ask the patient, how long have you been having that white phlegm?
Okay.
And the patient will most commonly tell me, I only have it for like 3 to 5 days. If that is the case, I will not require any antibiotics. Okay. Because again, it might be viral. But if there is a case of doc, I have a colored phlegm. I have
like the yellowish, green, right? Yeah.
Yeah, yellowish, greenish phlegm. How long have you been having that? For around 2 weeks. That is one of the cases wherein antibiotics is required.
Okay.
Okay, because it has been from a viral phlegm to a bacterial kind of phlegm.
So what's the difference between a viral cough and a bacterial cough? Is one more dangerous than the other, or they are both dangerous?
Well, having sicknesses is dangerous, right? Okay. But it's a matter of treatment for us.
Okay.
Right. If the patient has a colored kind of phlegm, it most usually responds to antibiotics. But if the patient has a virus kind of phlegm, antibiotics cannot be taken because it has no use. Yes. There is just one kind of phlegm that I really am worried about.
Phlegm with blood.
Yes.
I guessed correctly.
Yeah. If the phlegm is colored red, why? Why and how? So the patient most commonly tell us that he has a history of tuberculosis, and they did not finish treatment.
So that's why it's important to finish your tuberculosis treatment. Yeah.
Yes. And tuberculosis is very hard-headed. You know, it's a hard bacteria to really treat. Yes. So those are the kinds of phlegm.
Wow. Okay. So now I think that will be an interesting clip, Doc. You know, just on how do you diagnose a cough? Well, I think that's fantastic. Thank you for sharing that, Doc. Now that we know whether a cough is viral or bacterial, that means whether the lung infection is bacterial in origin or viral, right? So that we can have a proper treatment. And antibiotics will work very well for bacteria, but if it's a viral infection, then vitamin C, PPARs, lots of rest. That's the most practical. All right, Doc. Wow, thank you for sharing with us. Now, at least when we cough, we know we have some rules. If it's anything more than 2 weeks, we should really be concerned. If a cough is sort of more like a dry cough with clear phlegm, we probably have a viral infection. And if it's colored phlegm, we have a bacterial infection. Bacterial infection, we'll do antibiotics. For viral infection, vitamin C, PPARs, and water, and lots of rest, right? Wow, those are fantastic tips, Doc. And at least now we know. Doc, now we're very excited to know. Number one, how can you clean up your lungs? Is there a protocol, or are there things that we can do to clean up our lungs? I speak as a Manilan. I think everybody who lives in Manila wants to know if we can clean up our lungs. How would you advise us?
There are many ways, there are many ways, Sean, that we can clean up the lungs.
Okay.
And you know what? The manners of cleaning up the lungs is done naturally, and most often it's free.
Oh, it's free! Magic word! Free! Okay. Yes, please share with us how to clean our lungs freely.
Okay, freely, okay. Number one is check your environment.
Okay.
Okay, check your environment. If your environment is like polluted,
okay,
if you can, avoid it.
All right. If you can't, then do we get an air filter? Do we need an ozonizer? I mean, is that even useful at all? I mean, it's good to know. I get to ask a doctor.
Yes,
do ozonizers work? I mean, is this a gimmick, or is it helpful?
Well, Sean, I practice ozone therapy, so I believe in ozonization.
Okay.
Okay. So, but before ozonizing, because ozonizing is really great to kill the virus, to kill the bacteria, but you have to filter first.
You have to filter the air first.
You filter the air first, because there are many larger particles, pollutants, that can be done, that can be filtered first. Okay. And then the viruses, those small ones, those bacteria, are the ones that actually pass onto the filter, and then they can be killed by the ozonization of that particular space. But the thing is, when you ozonize a specific space, you should not be there.
Oh,
because
okay.
Ozonization, when you turn on your ozonizer and then you inhale you inhale the ozonated area,
it hurts.
It's not good for the lungs. It's not good for the lungs. Yeah, because the alveoli of the lungs
will get damaged.
They will get damaged. Yes. So be very careful with ozonization. Okay. You have to use it correctly. How to use it correctly? You can get an ozonizer, depends on the area. If you can have the small one if you will get a small area, but you need a big one if your area should be sanitized very good, or you need to sterilize a lot of things. And then when you ozonize that specific area, at least 15 minutes, and do not go inside within that 15 minutes period.
Doc, that's a fantastic tip, because I know many vehicle drivers, they put these portable ozonizers in their car. Yeah. And they switch it on in the car. And maybe for a lot of Grab drivers, taxi drivers, they do that. At least in Singapore, I've seen people do that. So that's actually bad for your lungs.
There are many UV rays, Sean. There are UVA, UVB, UVC. The one that is very good to clean the air, to clean the space, because it's really good for sanitation, is the UVC.
UVC.
Yes, okay. Ultraviolet C. But the thing is, most ozonizer, ozone generators here, when you trigger the UVC, and then we get to inhale. Because there is a specific smell.
Yes, it smells like fresh rain, like lightning, thunderstorm.
Yeah. Because ozone is being produced naturally whenever there is lightning.
Yes.
So ozone is actually nature's way of sanitizing the environment.
Wow, I never thought about that. It's wonderful. It's wonderful. Nature actually has a sanitization process.
Yes, it is a sanitizing process. It's called ozonization too. It's being done big time through lightning. And us, with all the modern equipment that we have, we actually haven't found a specific equipment yet that has the capability of to trap the wattage or the energy of lightning. Haven't
Wow.
had, yeah. But then again, in small apparatuses, we get to produce a great deal of ozone to
Hmm.
sanitize things, but we have to do it safely, because if we do not, that specific procedure that should be good for us will be bad for us,
It will damage the lungs.
damage the lungs. So
Wow,
do
that's
not ever inhale ozone, because it's bad for the lungs.
oh wow. Okay, that's very important tip, everybody. Because when I was younger and I had an ozone machine, I was like, I like the smell of clean. So I did not know that I was actually damaging my alveoli, which is your lung cells, right?
Yes,
So
yes.
don't do that, okay? And so if you ozonize your room, don't go into it for at least 15 minutes. Now, Doc,
Yes,
you talked about breathing and cleaning our air. I want to ask a very simple question. Here in Philippines, people love their air conditioning. Is it good to always be in air-conditioned room? And I think right now, because of the COVID-19, maybe some of us think that it's safer to constantly aircon rather than expose ourselves to fresh air outside. So what's your take on that with regards to lung health?
in comparison, with air conditioners and clean fresh air, I would always go for clean fresh air.
Okay, but what about air-conditioned air, and Manila air?
If you have that specific Manila air with all the combustions of the exhaust,
Yes.
with all the engine exhaust air, that is not actually good. So if you're going to compare it, it's a matter of comparison. If you compare a fully air-conditioned air always versus a clean fresh air, nothing beats clean fresh air.
All right.
But if you are comparing the all fully air-conned area versus an air that has been subjected to a lot of engine exhaust fumes, then I would prefer the fully air-conned one.
Okay, because the aircon filter actually filters the air, right?
Yeah. So if you have a specific space that has clean fresh air, then do not always go into the fully air-conned room. Go for the clean fresh air.
Doc, for those of us who live in Manila and like Makati, where we cannot avoid pollution, would you advise doing this? That means we change our air early in the morning. That means in the morning before the cars start coming out, we open all our windows to at least let the stale aircon air go out and new air come in, and then we shut the door. I mean, then we air condition the new air for the rest of the day. Is that a good protocol? Do we need to actually change the air in our air condition, let's say our apartment? Because I think it doesn't seem very healthy if I'm breathing air that's 3 or 4 days old too. It doesn't seem okay.
True. Personally, I do that. Sean. In the morning, I turn the aircon at night, but in the morning when I wake up, I let the morning sunshine in.
Okay, kill all the bacteria and viruses.
Yes, and then I open my window.
Okay, to change the air.
Yes, to change the air, because it's really wonderful to smell the fresh, clean air in the morning, and then the morning sun will hit your face, and then you will realize, hey, I'm here again for another day, and God is good.
Wow, praise God. Okay, so what else can we do to clean our lungs? Okay, our environment, and what else? What other things can we do?
Okay, if you're smoking,
stop
smoking.
Okay.
If you are in an environment wherein someone is smoking, because we have what we call a second-hand smoke. Hand smoke, I suggest avoid those spaces.
Okay.
And then tell the person, hey, I mind that you're smoking.
Wow. Okay.
Yes. Because most often the smokers doesn't they know that the person around them doesn't mind that they're smoking. But when you tell them that, hey, I mind the smoking, if it's okay, please smoke outside, not inside the house. Then it's a good space for everybody.
What are there specific types of foods that is especially good for lungs?
Yeah, there are great food that's great for lungs, and they're quite delicious.
Oh, what are some of these foods?
There are food that you can munch on, and then there are drinks that you can just take. Okay. Some of the food that is very good for the lungs are greens.
Okay, greens. All right.
And some are most are greens. Most are greens. Most are greens, Sean. I prefer salads to purify our lungs.
Okay, that's great. So eat your vegetables. They are good for your lungs.
Yes, of course. Another one is tea in the form of teas.
Tea?
Most especially ginger tea.
Ginger tea. Oh, that's delicious.
Yes.
It's good for your lungs.
It's good for our lungs too. So whenever we have some cough, our elders most often will advise that, hey, drink ginger tea and add on some turmeric.
Oh, okay.
Yes, it's because they have great antiviral properties.
All right.
Great soothing properties here, and it's very good for the body.
Wow, that's great. Great, Doc. That's good advice. So it's called salabut, right? In Philippines, is it?
Salabat.
Salabat. Okay, so that's great. I'm sure all our Filipino listeners, you enjoy salabat. Now that you know, that's actually a good drink for your lungs. So if you're having a cold or cough, don't add too much sugar because that sugar is just going to give you inflammation, right? Back to square one.
True.
So enjoy a salabat with just a hint of maybe, I don't know, honey. Honey, right?
Honey. Some honey, yeah. Because there are many studies when you put ginger and then turmeric and then add on honey, it's an age-old tradition, and it cleanses the lungs.
Wow, that's great. That's great. You know, that's exciting. So now for all of us during COVID-19, we should keep our lungs as healthy as possible. So do that as well. All right. Now, Doc, now let's go and talk about, you said that we can treat lung diseases naturally. How do we do that?
Okay. Number one, diet. Do not eat diet rich in inflammation.
Okay.
Meaning, do not eat meat.
I can hear our listeners saying, why do you hate us, Doc?
No, it's a matter of if you have a loved one who is sick.
Yeah.
When you buy 1 kilo of pork.
They're just being cruel.
Yeah, or 1 kilo of oranges or dalandan. If you have a loved one, you will actually buy something that is healthy.
Okay.
So when it's an intuition. It's God-given intuition that, hey, if someone is sick, do not give him a highly inflammatory food. Do not give him fried foods. Fried foods are really rich in inflammation. Even donuts, because donuts are most often fried, and then they have lots of sugar. So those are not kind because they promote inflammation.
Oh, wow. Okay, that's good advice. What else can we do to treat? Diet is number one. What is number two? Diet
number one. Number two is clean air.
Okay, that might be hard for Manilan.
But there are spaces now here that is, you remember condominiums?
Yes.
They put a specific space wherein there are trees, and then there is
that's true. We have an amenities floor, where there are trees.
Yeah, true. And then another one is it's also right now. It's trending in Facebook and social media. That putting plants inside a home.
Yes. My wife does that. There are specific plants, like I think snake plants are very good. Snake plants produce lots and lots of oxygen.
Yes, there are indoor plants like snake plants that is very good to get carbon dioxide and produce more oxygen.
Yeah, and I heard snake plants produce oxygen even at night. And I think you need 4 plants, 4 pots of snake plants for 1 human being. It will generate enough. Yeah,
Yes.
yeah. Jocelyn did some research on that.
So you are a certified plantito.
Ah,
Plantito and plantitas, they're called plantitos and plantitas. They are the people who love plants at their homes.
okay. All right.
Plantitos.
So I'm a
Plantitas.
plantito.
Yeah, you are a certified plantito.
All right, that's great. Okay, so our first diet, then our environment, have plants in the house that will help clean up your air. All right.
Yes, yes.
Is there a step 3?
Yes, of course. You have to hydrate yourself big time.
Drink lots of water.
Drink lots of water, huh? Do not drink soft drinks because soft drinks or sodas, they are high in sugar and then produce more inflammation. Even those juices wherein you get by the Tetra Pak and then you get it by the bottle, it has many sugar. So please, what I'm promoting with the hydration is just water or freshly squeezed vegetables or freshly squeezed fruits.
Okay, all right. But water is the best, right?
Water is
the best. Now, Doc, I want to ask you this question because I think this is important. In Chinese traditional medicine, cold water is bad for you. Cold water is actually bad for you. So what is best is actually when people are sick in Chinese families, traditionally, they give warm water, not hot water, but warm water. Now I would like to ask you, Doc, is there any, from your perspective in your practice, would you encourage patients to drink cold water when they're drinking plain water, or would you encourage them room temperature or warm water? Which is the best for a recovering patient?
Yes, whenever we drink water, I would suggest every one of us will not drink it cold, because especially when we're recovering, because we have to imitate the body's temperature. And the body's temperature is warm. It's 37, 36 degrees. Whenever we drink a warm water, just the usual filtered tap water, it's the temperature is usually 20s, 25, 24. Those it actually imitates almost the temperature of our body. Yeah. Whenever we drink cold water, the temperature is really down. So it takes more effort for the body to increase the temperature and then use it.
And that, I don't know whether there's any truth to it, but the Chinese folklore is like, if you drink cold water, you sort of cause pneumonia. I mean, you make your lungs wet. That is what our grandma, our Lolas, told us. No, you shouldn't drink cold water. You're gonna get rheumatism, and that's their concept. Is there any reason why old people would say that?
I would believe that whenever we drink something that is hot, as tea, it promotes bronchodilation.
Yeah.
Yeah, it promotes bronchodilation. It dilates or it expands our airways, and it also expands our blood vessels.
Okay.
So it's a very good modality whenever we're healing. We drink teas because it dilates, and then the more recovering areas of our tissues will be healed faster.
So the cold water is the reverse effect.
Yes.
So Lola's advice may not be accurate in the description, but in practice, it's a good practice not to drink cold water when. Yeah. All right. Okay. Finally, I get a final answer, so I surrender. Okay, that's good. Doc, when we are taking supplements to heal ourselves naturally from lung diseases, what do we want from our supplements? What action? Is it, again, immune system, anti-inflammatory, antioxidants? Are these the key functions that we are looking for when we look at supplements?
Yes, of course. There is a thing called antioxidants that is really helpful whenever we are whenever our body is stressed and whenever we are recovering. we need those antioxidants to help us recover and sequester the bad things inside.
Okay.
So yes, we need supplements that is very good for decongestion, very good to detoxify,
Okay.
very good for anti-inflammatory healing, and then very high in antioxidants.
Wow. Okay. So in selecting, so everybody, when you are finding a lung disease, in selecting your supplement, the action that you're looking for is supplements that help to reduce inflammation, help to detox, and that's really great. You clear the inflammation and strengthen your immune system. So these are the three primary functions that you want to look for when you supplement for lung diseases. And actually, that applies to most diseases, right, Doc?
Yes, of course. Even as grave as cancer, we can help people, people with arthritis, people with diabetes, people with hypertension, the chronic ones, chronic pain, people with chronic pain, and even people with cancer.
You know, Doc Meddie, as I talk to you, I realize how we've been trained so differently from young, based because you know when we are speaking in a manner like this, it's the same, no matter what illness, from mental illness to cancer to metabolic syndromes like high blood pressure, hypertension, cardiovascular problems to lung diseases.
Yes.
The natural solution is always these basic three things, right? Detox, inflammation, anti-inflammatory, and boost your immune system.
Yeah.
But yet we are trained because when we grow up seeing doctors like yourself, right, we have this idea that for every illness there's a different approach. But the more I learn about natural healing, it's always the same. It's actually always the same three approaches. And yeah, and it's amazing. Do you have any comment about that? I mean, am I wrong? It seems like when we talk about natural healing, it's always back to the basics. It's always drink water, fresh air, have mild exercise, don't take inflammatory foods. Whether you have cancer or you have gout, it's the same prescription. But yet when we go into a hospital or clinic and pharmaceutical, we have this drug, that drug. You know, so we are sort of trained like, okay, I have this problem. Doc, why are you telling me the same prescription as my headache? Doc, I have cancer. Why are you giving me the same prescription as if I have diabetes? So, yeah, can you enlighten us? Am I wrong?
Yeah. We are actually taught two different things. There are theories. One theory is called the germ theory. Okay, germ theory is thought of by Louis Pasteur.
Okay.
That is the main foundation of conventional medicine. The germ theory states that a specific disease is caused by a specific germ. So if we eliminate that germ, we cure the disease. Okay, that is the germ theory. The germ theory by Louis Pasteur. So that is on that specific foundation, synthetic medications are born.
Okay, makes sense.
Penicillin is a great antibiotic at that time, that almost always cures almost all diseases at that time. It's a great antibiotic. But now we do not use it as often as before because of resistance. Okay? On the other paradigm of the germ theory is called the theory.
Sorry, what theory again?
The environment theory or the terrain theory.
Terrain theory, okay.
Terrain, yes. The terrain theory by Antoine Béchamp.
Okay.
That is the foundation for the natural medicine. Okay? The terrain theory believes that even though if you have a specific germ in your body, but the environment is really good, the immune system is great, your body has the ability to combat that germ. So no disease will ensure.
Wow. So it seems like the terrain theory, which is what the natural healing and integrative doctors like yourself employ, is like an omni or multi-purpose strategy. No matter what diseases come, if you maintain a healthy environment, your immune system, everything works. Then, so actually, it's almost like our human immune system, because we don't have special. Our one immune system works for every, like the specific germ theory approach.
Yes.
I think that seems like a sure winner, because why would I carry a gun that can only shoot one type of target? I would want to carry a shield, right? That covers everything. Now, if there's something special in the environment that this overall shield cannot handle, then we want to go and find a specific tool for that particular problem. So,
yes,
wow.
yes.
So it's actually like our interview with you in the past, right? It's not terrain or germ theory. It's more of both, right? But it would seem to me more logical or safer to make sure that every individual is employing the terrain theory all the time. And if it cannot be handled, then we bring the germ theory approach in.
Yes. And you know what? There are studies that people who use the terrain theory approach are happier people.
Yeah, I'm sure. Because we don't have to stay in the hospital.
Because they take care of their body better. They take care of their body better. They are healthier individuals. The people who practice the terrain theory because they do not want any synthetic medications they're having every day.
Wow, thank you so much. Today we again, this is mind-blowing, it's paradigm shifting. You know, are you only practicing germ theory, or are you also practicing terrain theory? Thank you very much, Doc Meddie. So there you have it. Doc Meddie talked about lungs, gave us an idea how important our lungs is, all the different steps to take care of our lungs. You know, take a look at the summary over here. Yeah, these are the steps that you can do to have a healthy lung, and how to treat your lung disease naturally. So without further ado, let's welcome Doc Meddie back, because we had to do a special retaping for this closing because our connection was not very good during the last recording. So Doc Meddie, any last words and advice for healthy lung and how to treat your lungs if you do have any respiratory diseases?
Okay, thank you for that, Sean. Remember, treating lung diseases, we have to consider first the natural approaches in cleaning our lungs and our respiratory system. Okay, do not forget the tips that I taught you, and do not forget that we can heal and clean our lungs naturally. Okay,
all right.
For these times, we have to stay at home. And you have to stay happy at home.
All right. Thank you very much, Doc Meddie. Again, thank you for your tips. We're so thankful to know that you can actually treat lung ailments naturally. That's amazing. And thank you for your tips on how to keep a healthy lung. So we look forward to seeing you again on another topic at Simply Healed by SimplyNature. So goodbye, Doc Meddie.
Wow! Hi, Sean!
Thank you for joining us on this very important and timely webinar on lungs with Dr. Meddie. We want to thank Dr. Meddie for all her tips on how to have a healthy lung. She mentioned you need to have antioxidants and you need to bring down inflammation. And that's exactly what we have in our SimplyNature PPAR tablets. Our SimplyNature PPAR tablets is rich in antioxidants, and it contains omega-3 and 6s. It contains vitamin B groups and the vitamin C, vitamin D, vitamin E, all the different vitamins that you need for a strong immune system and anti-inflammatory response. More importantly, our tablets also contain PPAR agonists, which are gene activators that will activate your immune system and also your anti-inflammatory system. Now, if you actually have lung diseases, then you want to use our soft gels and our jar and liquid, depending on how serious it is. So if you just have lung diseases, you can start with our soft gel together with the tablets, because the tablets is for overall healthy lung nutrition. The extracts are so that your system is truly primed up and ready to fight and is able to recover from your disease. Now, if you have something as serious as lung cancer, then really you have to try and start using the SimplyNature extract liquid, all right? Because lung cancer usually it's a very rapid cancer. You usually only have 5 months on average. So you want to start with the strongest. Well, no matter whether you're just asking for lung nutrition or you have a lung disease that you need treatment, just drop us a note at SimplyNature Facebook Messenger, and one of our staff will answer all your questions and link you up with the appropriate doctor. And if you'd like us to link you up with Dr. Meddie, we will be more than happy to do so. So drop us a note on Facebook, on SimplyNature International Facebook, on Messenger, and we will reply you. Stay safe, stay healthy, and we'll see you again next episode of Simply Healed by SimplyNature.